All right, hello everybody. Welcome back to our channel in our macros and micros conversation. Today, Dr. Maggie and I actually want to talk through McKenzie Method Progressions for our cervical spine. So, Dr. Maggie is of Recenter Chiropractic Wellness and Functional Medicine.
Yeah, you got it. Long
I
one.
only
Yeah.
got that because it's on your T-shirt, and I'm Rothrock Chiropractic and Rehabilitation. Neither of us chose names that are really easy
Yeah,
to
I know.
digest, but also hopefully names that do actually truly reflect what we do. So Dr. Maggie does dabble a little bit in McKenzie Method, but myself, I'm a certified McKenzie Method provider. So I go really deep
Yeah.
into the well with all this, and we work with this every single day with patients. So for the cervical spine, neck pain is a pretty common issue that we have here in the U.S. and in central Pennsylvania, Centre County, and State College in general. So these exercises and these logical progressions are really beneficial for a lot of people.
Yeah.
Agreed?
Yeah,
Yes.
absolutely.
Awesome. So in McKenzie Method, we have a concept that's called progression of forces. And the argument is that we first start with the least amount of force to see if a patient is capable of getting themselves better, and then move up the ladder either as clinically indicated or as just a way to further improve therapeutic outcomes at our office, right? And so, what we're going to start with is a lot of neck cases actually get better just by working on retractions.
Yep.
So I'm going to have Dr.
Yeah.
Maggie actually demonstrate how to do a retraction
Okay.
exercise.
It looks
So
good.
she is going to be sitting here, and basically she's imagining that she's taking her head and neck and sliding it straight back over her shoulders and her upper back. So go ahead and hit one of those. There you go. She would hold for about 2 seconds and then slide back forward, and then pull back. 1, 2, bring it back forward. How does that feel, Doc?
You can feel it. It feels, I mean, for me, it feels good. Like
Yeah,
that
yeah,
hurts so good sort of thing.
right.
Just because I'm a little tighter, but yeah.
And I think what I feel a lot of times, and what a lot of patients report to me when they're doing that, is they can feel it really strain the bottom of the skull, and they can
Mm-hmm.
usually feel like a little bit of like a tightness sensation in
Yep.
between like the shoulder blades and down into the top of the shoulders there.
Yep. Yep.
Now, what she could also do is go to tier number two, which tier
Mm-hmm.
number two is she would place a set of fingers on her chin. And then that way, after she pulls back, she could actually use the fingers to add a little overpressure on there. So that way, it's just helping that neck to move another like centimeter back and add just a little bit more load onto that cervical disc, that nerve, and stretch out those muscles there. Now, you notice she's doing a great job of keeping her head level. A common
Mm-hmm.
mistake that can happen to people when they do these is they start to retract and then they push, but then they're forcing themselves to tuck. So we're not trying to tuck, we're trying to slide.
Mm-hmm.
This is such a silly analogy, but it helps people really nail down how to do retractions. I'm gonna have a pie on a plate right here on my hand. And if I'm trying to shove said pie
Mm-hmm.
right into Dr. Maggie's face, first of all, I'm not a very kind person for doing that. But if I try to go shove the pie in her face, she's trying to imagine like she's pulling back to get away from that pie and not have it
Mm-hmm.
squish her in the face, right?
Mm-hmm. Mm-hmm.
That's a pretty good
Yeah.
way to kind of talk through
Yeah,
it.
I like that. And sometimes I'll even say like pretend this is another way. Pretend your chin is resting on a shelf. It's not
Yep.
going down or up. It's staying on that shelf.
You sound just like me now, but we preach the same
Yeah.
way when we're teaching people how to do these. So
Yep.
step number three, tier number three, is
Mm-hmm.
to do something that's called clinician overpressure. So what that is Dr. Maggie is still going to be doing her retractions, but instead of her using her fingers to add a little overpressure, we can
Mm-hmm.
actually come and do a little bit of our hands just to get, again, another few centimeters of movement, a little bit more force drive through disc, joint, muscles, nerve, right?
Mm-hmm.
So it would look like this. So she is
Okay,
going
so you
to do her retraction there. I'm going to have a hand
okay.
stabilizing on the upper thoracic spine as she pulls back into retraction. And then after she does, we go here and we add just a little more overpressure and come back forward. A little deeper, yes.
Mm-hmm.
Definitely a little. Go ahead and do one
Yep.
more just for demo. And again, that's definitely deeper than what you got when you were doing them on your
Yeah.
own. And then the top of the progression for a seated mobilization before we get into anything that's like a chiropractic manipulation would be to just say, okay, now she's going to focus on just being nice and relaxed, and
Yeah.
we, the provider, are going to do all the work. So we call this mobilization. So on this one, I'm going to be on the back, same setup as like the clinician overpressure,
Mm-hmm.
but this time we get her back into retraction, and then we use this hand on the upper back to actually push and add pressure forward. That way the chin is stopping up against the hand, and we're actually moving into retraction from the bottom up instead of the top down. Doc, how does that feel?
Good.
Okay. Definitely like a good deep stretch on that, right?
Mm-hmm.
And what I'll typically do in practice is we usually don't have enough time to logically go through all four of those progressions and
Right.
figure out like, okay, that's where we're stopping. What I'll typically do, I don't know if you have a similar experience, but when we're doing the McKenzie protocol, we're trying to see if retraction is the directional preference for the neck. So the patient will do like 10 to 15 of those. A lot of times we'll see a few or many baselines get better. We'll say, that's great, that's your directional preference, that's
Mm-hmm.
your home exercise, go work on that. If we just see a bunch of no changes and the range of motion doesn't improve, the symptoms don't change at
Yep.
all, then what I like to do is say, like, okay, you first of all prove that that exercise isn't going to harm you, but let's see if I do that last technique we just did there, that mobilization, and really kind of drive more repetitions of retractions. Like if I do 8 reps of those, it's like equivalent to you going and sitting in here and watching you do 50 of those right in a row.
Yeah.
So we're just speeding up the time frame to then say, if you have more volume at home, are you in fact going to get better? If the answer is yes, then that's your
Yeah.
exercise, right?
Yeah.
I hope that kind of makes sense.
Yeah.
A lot of times it helps to kind of be a patient or just to like be a clinician and have firsthand experience. But hopefully this was valuable to also talk through
Mm-hmm.
and further demonstrate that both Dr. Maggie and myself, we kind of value keeping safety in line first.
Yeah.
I think there are too many times as chiropractors we jump right to the manipulation when we haven't really figured out if that patient can actually tolerate that.
Mm-hmm.
So if somebody's barely able to do a retraction, I'm not going to wail on their neck. It's going to make
Right.
them worse
Likewise.
instead of
Yeah.
better. So
Yeah.
so it just bakes in a lot more safety, a lot more communication, and a lot more empowerment for our patients, right?
Yep.
Any final thoughts you'd like to add to this?
I don't think so. I mean, yeah, you covered all the bases. That's how I approach it as well.
Mm-hmm.
So yeah, I really love, and it was great to be one of your patients to see how that feels. It's just
Well,
a
hopefully that does feel
reminder.
a little bit better.
It
Just even
does. It
getting
was needed. It was needed. Yeah, it
after
was
just
needed.
getting a little bit of mobilization work.
Yeah.
Tune in next month because this will actually be next month will be tier 5, where we actually marry the world of McKenzie in with the world of chiropractic, because the tier 5 is a manipulation. So we'll show how we like to do neck manipulation here. What we'll probably do, if you're good with this, Doc, is
Yeah.
we'll show like how I do it, and then Doc will also probably adjust me so you can see how her technique is. Similar, maybe slight differences,
Yeah.
but hopefully all the less beneficial for patients, right?
Yeah. Sounds good.
Well, if you liked this video and you found it helpful, please like and comment and subscribe to our channel to kind of see more content. But we appreciate you for watching, and thank you so much, and take care till next time.
Thank you. See ya.